Just imagine all the breakthroughs that we've missed out on in women's health by not focusing on them.
In terms of women's health research, we know very little about women's health. Women suffer from more chronic diseases, even though we live longer than men do. We suffer from more side effects of drugs when they first come out. And part of the big problem for this is there's not enough research on women's health issues specifically. When we actually look at the amount of funding that we have in Canada that's dedicated to women's health, it's actually a very small percentage. It's between 1% and 8%. And this should be concerning to everyone. Women are 50% of the population, and of course, if we're only getting 1% to 8% of the funding money for women's health research, this has strong implications for why we have a lack of knowledge in terms of what promotes women's health.
We're not focusing our funding on women's health, and I think we're seeing it in our outcomes.
Throughout the history of research, most research has been done on men, and women have been really left behind or considered to be the same. But women are not the same. They have different hormones, they have different social circumstances, and all of these things play a role in how they access care, how medications work for them, and what the outcomes are.
So very recently, the funding agencies in Canada implemented something called SGBA, which stands for Sex and Gender-Based Analysis.
So it's great that researchers are studying sex differences. I study sex differences. It's really moving the field forward. However, we're still lacking fundamental knowledge about females' physiology, and it's still hard to get funding to look at only female studies. For example, we've been trying to get funding for a grant that looks at the perimenopausal period as a period of intervention for later cognitive outcomes. And the last 2 times that we put this grant in, we've been told that we need to include males, which just doesn't make sense when you're looking at something like menopause.
And so there are fewer grants, I think, that will be funded for women's health. Women, who are the ones that are often doing women's health research, are less likely to be funded for long periods of time, and also less money per year, to the tune of about $50,000 a year, which you can imagine over time is a lot of money that women's health specifically is missing out on.
There are proven differences between women and men when it comes to getting funding, and it happens all across the continuum. For instance, men are much more likely to put their projects forward. Women are much more likely to understate what they find and what they're producing. And so when the reviewer sees that, the more confident grant is the one that's reviewed better.
When I'm writing my research proposals, I've changed the way that I address the questions that I'm interested in. I feel like I'm a little bit more vague in my terminology. I try not to be so female-centric. It's very disappointing as a researcher to have to make these small accommodations in order to be considered for grants. I think it's a real disservice to women's health.
Funding from smaller institutions like the WHRI, it allows investigators to get that first small grant that can get them their preliminary data that they can put in their bigger grant. It will increase their chances of getting that bigger grant. So it's very important to catalyze the beginnings of things and the movement forward of research for women.
What gives me hope is the BC Women's Health Foundation and other societies like this that are addressing the disparity that we're seeing in research.
The future that I'm looking for is that at least 50% of the research that's funded out there is dedicated towards women's health. It's going to take a lot of researchers, it's going to take a lot of money, and we can get there, but we need that dedication. We need people to understand this is really important.
I sincerely thank everyone that supports this foundation and supports the research that we're doing.
It's really important for women to build each other up. That's one way the WHRI strives to help women to be successful in women-centered research, to put women forward and put female researchers forward, and the male researchers who are trying to do work for women forward, so that we can improve the lives of women in British Columbia and Canada.